Consistency and reliability of information has certainly so far tended to result in fewer phone calls backwards and forwards to query information or missing bits, potential errors. We seem to be getting more direct and more correct transmission of the information. Certainly I get the impression that we're having to go back and look at lab forms less frequently now, just because they're getting done better in the first place. They don't have to be signed anymore. The whole sort of transmission of information and security system using barcodes and electronic systems has smoothed all of that out, and if forms get lost, it's a much easier proposition to replace the order at the point of patient attendance. So there's a lot of good stuff like that, which just makes the whole thing less error prone.
There are two different views of the form, and that makes it much easier to be able to look for what you want. The front page has always had the standard tests on it, and that's got a good range of standard tests that are readily accessible and commonly used, and I would say that most of the time I just use that front page, which is a lot easier. With the form view, it's the tick boxes, and with the more tests view, I can then have some protocols that are set up, and so there is protocols for diabetes, for drug monitoring, and in fact I can create some of my own. So if you have a standard set of protocols that you'd like for blood tests for people on particular drugs, or doing regular tests for something, then you can set those up and it will just come up as a regular pattern.
Sometimes the lab need to know which antibiotics a patient may or may not be taking, so that they can then alter the way they process the specimen to try and give you complete information. Urine samples come to mind with that. If your patient's already on antibiotics, you can then make sure the lab knows which antibiotics the patient is taking, and they can then take that into account when they process a specimen. Cervical smears also trigger off a specific cascade of tick boxes, so that the lab knows where the specimen is taken from. Is it a cervical smear, or is it actually a Volt smear? Whether you need HPV testing with it, whether the patient is postmenopausal, if there's any specific medications they're on, and so on, so that particularly if there are abnormalities, the lab can then interpret the information better and give better feedback.
Knowing that labelling and patient identification is much more secure once the specimen has been sent off in transit and in the laboratory is certainly an improvement, and the impression so far is that we're probably getting fewer invalid test procedures as a result.
The other thing about eLab is that I can still print off a form, but also that form instantly goes off to the laboratory. So if I had someone who'd rung up, or we had done some tests on and I needed them to do some extra, then I can print a form off here or write it up here, and then they can just turn up at the lab and the form will be already there, so they don't have to come and get the piece of paper. The other thing is, for our home visit patients, we can similarly write up all the tests that they need to be done, and there is a box on the form that says that it's for a home visit, and once you've got that set up, then they will go off and do it, and they don't actually need the form.
Without eLabs, the process was far more steps involved. The nurse or one of us would have to phone the lab, speak to somebody at the lab to pass on the information. They'd have to then verify that the address was correct, the name was correct, and so on, and then book a time and then go off to see the patient. Whereas this, we can just do in the course of our day's work, just pop in, fill it in, and it goes straight to the lab electronically.
The whole layout and methodology of use is pretty intuitive, and once you've used it for a short period of time, there's no problem really.
On the forms we can change the date, so if you had someone who had a blood test and you wanted them to do it in a month's time or something like that, you can change the date on the form. The other part that's really great is that if there's any tests that require special activities from the patient, so to speak, so if they have to fast or they have to change their diets or all those sorts of things, those things come up automatically printed on the form. So I can just tick fasting lipids or whatever else that I want to get done, and there'll be a little instructions for the patient about what they should be doing.
For other practitioners, I can only recommend this as being a really progressive step to joining everybody up to a modern information system.